Hey everyone, this is Dr. Jawad from Total Health and Wellness Center. What we have here, we have a 17-year-old softball player, and she injured her low back and her hip. And how did you do that?
Playing softball.
And how many days ago was that?
5 days.
So you've had the pain for 5 days?
Yeah.
Okay. When does it hurt the most?
From like going sitting to standing up and like rolling over in bed.
Okay, sitting to standing and rolling over in bed hurts the most. Okay, so let me move over here. Okay? So I like to see, let's see how it looks. Okay, so why don't you show where the pain is at, where the pain goes?
Like all the way across here.
Okay. Now, did you notice when she stood up, she favored the injured leg by putting more pressure on the right leg? Okay. So let's have you go over by the table. Okay. Good. Good. Let's get you on the table. All right. Let's have you lay down. Okay, so this is a very, very typical presentation of an SI joint dysfunction or SI joint subluxation, depending on where you're reading it from. So the key elements is the fact that she was playing softball. It was 5 days ago. She has pain from her low back, and it almost mimics a herniation or sciatica. It comes from the low back, and she's given a wiping presentation down her leg. Sometimes it also presents also down to the foot. Now, when I palpate her SI joint, okay, when I palpate the right side, how does this feel?
Tender.
That's tender. How does this feel?
It hurts a lot.
Okay, hurts the most. Hurts a lot. Okay, so the anatomy of the SI joint, you have the lumbar spine, which joins into the sacrum, which is your triangular bone. And you have 3 parts of the pelvis. You have the ilium, the ischium, and the pubis. Don't worry about the other 2. The ilium and the sacrum join together to form the biggest weight-bearing joint of the body, which is your sacroiliac joint. Now, feeling her posterior superior iliac spine, I could tell what's going on is that it's actually rotated posteriorly. So her left SI joint is rotated posteriorly, while her right side is actually rotated anteriorly. That's why she's tender on the right-hand side, but most tender on the left. Okay? So I do an evaluation. I always want to check the leg lengths. Okay, so she has a left short leg about 1/2 inch. Now remember from Schoolhouse Rock, the leg bone connects into the pelvic bone, so when this is twisted posteriorly, it's going to bring the leg up. Now the dynamic feature of the SI joint is that it moves only millimeters. Okay, probably about 1 to 2, maybe 3 millimeters. However, it's involved in every single motion. Remember, when we use our legs, we go from a seated to a standing. Her SI joint wants to move, but her left one in particular is locked, and this is where she's getting pain. Now, don't forget, we also have the lumbar nerve plexus, the lumbar plexus. We have the sacral plexus that comes through, okay, the pelvic girdle. You have the sacral plexus that comes through the piriformis, and this is all being compressed. And this is what mimics the pain down the leg. Okay, so what I do a series of 3 adjustments. I'm going to do a series of adjustments, 1 in the X plane, 1 in the Y plane, and one posterior anterior in the Z plane. Okay, so let me just have you scoot down just a tad. All right, good. I like using drop tables with this because I could really isolate this joint and really make it move. Okay. So I bring it up. Now what I want to do is that I want to traction her leg. Okay, so I traction her leg down, and because I'm using my left hand, I'm actually using my forearm, and I'm going to draw it laterally, okay, to get the Z plane. Okay, there you go. There's 1. And then I'm going to go on the Y plane. I'm going to go down. Up. There you go. And then I want to go on the Z plane. There you go. All right. Now, how does this feel now? Does it feel less or more?
Less.
Okay, moves less. Now, again, when I palpate it, I'm not feeling that knobby anymore because now that's a good indicator that it's actually rotated. However, there's one more component involved as well. Because the lumbar spine, the erector spinae, the quadratus lumborum, the glute med, okay, they all work together to help to help stabilize the SI joint in conjunction with the lower spine. So this is also, how does this feel?
Sore.
Okay, it's sore as well, and it's also too, it's hypertonic. Okay, because you have the rotational component with it. So I want to adjust her lower spine to increase the rotation, take the pressure off the muscles, take the pressure off the nerve, so she feels better. So let's have you lay on this side and face me. Okay, good. So I bring this leg up, bring this leg down, scoot over here, give yourself a big old hug, look down over there. You make me nervous. I get gun shy. Okay. I like to have them increase their own rotation by dropping their leg, and I walk in. Okay, and you want to adjust the lumbar spine as well to free up the nerves, the joints, and the muscles and the tendons as well. So here we go. Look down that way. There you go. Good, good, good. Okay. All right, let's get you on your back. And I just want to do one more thing. I like just to give just a nice little yank of the leg. Okay, so I'm just pulling your leg. Okay. There you go, good. I also want to do both joints as well, both ankles. Okay, all right. So at this point, I like to walk away and I like to see them get up on their own.
Wow, that's a lot better.
How's it feel?
It's a little sore, but
How's your range of motion?
it's like 10 times better.
Beautiful, awesome. All right, cool, well, thank you very much. Thank you. Dr. Jawad from Total Health and Wellness Center. This is Shay, 17-year-old softball player. When's your next game?
Tomorrow.
Tomorrow?
Yeah.
Okay, well, I hope she does well. So I appreciate your time.
Thank you.
Hey, thank you very much. If you like what you saw, please share with a friend. My phone number is 630-653-2225. My website is www.totalhealthdupage.com. And thanks for watching. Thank you.